Hello everyone, once again welcome to my OIT channel. So today I came with an information video. This is related to urgent letter. So if you refer some of my letters, like previous letters of urgent letter, you can see that I have mentioned to write the past history first, then gradually we will come to today's visit. So there is some changes now because recently there was OIT officials question and answer live section. So in that they are explaining that it is far better to write today's visit first, then you can go back to the previous history. So now you will have confusion how to write this in this way. So I will give you some hint. It will be easy for you to write the letter. So how you can start? Example, I will tell you one story. So this patient in a nursing home or retirement village, and they have given some old history that patient has some shoulder pain, indigestion problem, and sleeping difficulty, shoulder pain, chest pain, jaw pain. So these everything. And this patient had some tablets, but even with the tablets patient is not getting well, and they are informing to patient's GP, even though the GP's consultation has been rescheduled to tomorrow. So they have given the next timing, that means the evening timing. These things that all happened in morning. Evening timing, patient's condition became severe and the BP became 180 over something like that. So the BP is increasing time by time, and even with the tablet she's not. So in this scenario, at last when we are trying to manage with some other medications, or even with the nitroglycerin spray or nitroglycerin patch, even with that, and even oxygen therapy, with oxygen therapy medications and nitroglycerin, even with all these measures patient is not getting well, then we are referring the patient to emergency department. So this is the scenario. So in this case condition, how we can write the present medical paragraph? So we will have confusion in present medical paragraph only, and they have given that suspected to have myocardial infarction. So how we can start? Always start with why we are going there, or this is, if it is a home visit, means we have to write that why this patient is under our nursing service. And if it is a nursing home, means of course we are the one taking care, and maybe we are the one in charge nurse there. So here in initial paragraph we can write that a patient is in village for this many years and under our nursing service, like that we can start. If it is in the home visit, means you can just start with this patient's name, you can just mention, and has been under our nursing service for the follow-up visit, like that we can write. So is in this case not actually, this is a patient admitted in the I mean it is a resident patient, so no need to mention anything, just you can start with today's presentation. So how we can start? Today, example patient's name is X. We can give Mrs. X. So you can just write that today Mrs. X presented with the so and so on condition, like a sleeping difficulty, tiredness, and increased shoulder pain, and chest pain, shortness of breath, or something like that we can write. Then we can write, therefore she was managed with these many medications. So they have given some medications. That medications we can write, like paracetamol, or something like that we can write. Then you can write, even though with the medications even though she didn't have any progress, or she has no progress, like that we can write. Therefore, or thus, she was her general practitioner was informed, but due to busy schedule, he postponed the visit. Then gradually we can come to the evening time. Gradually at around this time we can write, and her blood pressure became, we can write what is that at elevated blood pressure. Along with it, we can write the symptoms, like worsened symptoms, like a shoulder pain, chest pain, shortness. But the same thing only, we can just write she represented with the worsened symptoms, like that we can write, which aroused the doubt of her possible diagnosis. No need to write again myocardial infarction, you can just write which aroused the doubt of her possible diagnosis. Then what we did, we can write Therefore, she has been initiated with, or she was managed with the oxygen therapy or medications or nitroglycerin patch or spray or something, whatever the things we can write. Then we can write at the end, even though there is no, or if you used already even though means, here you can use any other synonyms. If there is no other synonyms, you are not getting any synonyms, just you can use but. Okay, so but she has no improvement, therefore she is being transferred into your facility for further management or further or an immediate attention. So like that you can sum up that present medical paragraph. That means the first paragraph of present medical paragraph. Then in the next paragraph, you can just write the old history. If there is any old history means, you can just write. That means sometime they have given 1 month ago. Already this problem has started. So in this case, what you can see that patient already started to experience indigestion and shoulder pain 1 month ago. So you can mention that one. But how you have to start? You have to start with initially. Initially, since this date you can write and Mrs. X, or else you can write has had also. Okay, you can just write Mrs. X has had indigestion or shoulder pain since this date and was managed with these medications. Like that, some history, if it is there, you can just write that history also. So this is the way we have to write. I will tell you another one more scenario. This is related to pericarditis, so it is familiar for you, Patricia style. So in that there are two case notes. They have not two case note, two scenarios they have given. First one, patient got admitted in the Green Valley Hospital 1 month ago with all some definitive symptoms of pericarditis. After diagnosis, a patient was managed conservatively and was advised to and was discharged with the home advice. But in home there was no one, so they have arranged one home visit. That means for today. And today we are going. When we went there, we saw that patient is not well with the tiredness, weakness, shortness of breath, which are relieved in rest, and patient complained of many things. So that things, along with that things, the BP also is increased, and we are suspecting that it is relapse or complication of pericarditis. So then we have to urgently refer the patient to emergency department. So in this scenario, how we can start? We can just start with the today's home visit, but patient was already arranged for today's home visit. So we have to start like this. Example, Patricia Style. So Miss Style. So we can write Miss Style was arranged with a home visit for today under our nursing service for the follow-up of his medical condition. Okay, then you can write on today's home visit this and things, so on, things happen. Then at the end you can write this is a reason for her referral. Then in the next paragraph you can write initially on this day Miss Style was admitted to Green Valley Hospital with the complaints of these things. Then the old history will continue, and at the end you can just write, therefore a home visit has been arranged for her until my service. That's enough. So that is a two sentences. There is a connection. After this sentence, if you see the first paragraph, that is a continuation. So it will come like a circle. So in this way, if you write, it will be far better for the reader to understand. So once the OET official has given some idea, means it is always beneficial to write in that way. So it is easy for you to get this score. So I hope it is clear for you. You can just see the things, what are the things I have given in the video. So it will be easy for you to understand. So I hope it is clear. We will see with another one informative video. Until then, bye. Take care.